Welcome back to the No Excuse Mindset Podcast. I'm your host, Wellness Coach Jay. Today's episode of the No Excuse Mindset Podcast, we're honored to have Dr. Jimmy Reyes, a bilingual nurse practitioner, educator, and public health advocate who has made it his mission to elevate health equity in the underserved community. Jimmy's journey started in Honduras. Is that right?
In Chile, actually.
In Chile. It started in Chile. Jimmy's journey started in Chile and brought him to Iowa.
Yes, that's correct. Yep.
He served as a faculty member, a national speaker, and a board member for several influential health and wellness organizations. From overcoming language barriers to becoming a voice for the voiceless in the medical field, Jimmy brings passion, cultural insight, and lived experience to every space he walks into. Welcome, Jimmy Reyes. How you doing?
I'm doing good, Jeremiah. How are you? It's good to see you again.
Good to see you again. You actually got your fitness start with me, right?
I did back in 2015. I remember living in Marshalltown and then coming to Des Moines to work for the Board of Nursing. And then about 5:30 p.m. in the afternoon, I would see you for about 60 to 90 minutes.
Yeah.
And that's how my journey started,
Awesome.
Working with you.
Awesome.
So thank you so much for helping me where I am today, actually.
Awesome. You keep on cranking it out. I see some of the stuff you're doing. It's awesome. Can you tell us a little bit about your personal journey, where you come from, and what sparked your passion for public health?
Yes, and actually it was my grandmother from Chile. She was a public health nurse, and she elevated me. She helped me and nurtured me and mentored me into working with underserved communities back in Chile. When I moved to the United States, when I was 16 years old in 96, I knew that I wanted to become a nurse, but I didn't know how to do it because at the time I didn't see others that looked like me in the United States to help me and mentor me. But I did make the journey from Orlando, Florida to Iowa. I remember driving in 1999 to go to the University of Iowa. I didn't know anyone here back in 99, and I arrived in Cedar Rapids, and I went to Kirkwood Community College, and then I met a lot of great people that helped me. And 25 years later, I'm still in Iowa because people have really nurtured me. I met so many great individuals that have helped me throughout my journey, and now I feel like I'm at a time that I'm giving back to my community because of all the great things that have been given to me.
Awesome. As a bilingual nurse practitioner and educator, how has your identity shaped your approach to healthcare?
It's been really an interesting journey because Iowa is a receiving community. We have so many individuals from Burma, Bosnia, Africa, different African countries, and also from South America and Mexico. And so you have a blend of people that speak different languages, have different dialects, and even someone from Mexico, and I'm from Chile, we have different dialects. We have different words meaning a little bit different at times. The food is different, our traditions are different, but we have also many commonalities. So trying to find things that I can see myself in, and also for them to see about something that we can agree on. And it's okay to disagree as well. But that's how, again, having the confidence to understand and educate and empower those individuals to make better healthcare decisions.
Definitely. You worked in both in the academic setting and in the community. What are some of the challenges you've seen firsthand in the underserved populations?
So when I went to the University of Iowa College of Nursing, and I knew that I wanted to give back to my community, but I didn't know how. And this is back in Iowa City. And I was a very young novice nursing student. I met others that looked like me a little bit, but I also relied on others from anthropology, the Spanish department. I met many great people that really wanted to do something. So we got together every Friday. And we had like what we call a cafecito hour, where we got together, we brought different foods from our countries, and we had potlucks every Friday in person in my undergraduate studies. And that sparked a passion that I knew that we all agreed that there were disparities and issues in our communities in Iowa City and West Liberty, Cedar Rapids, but we didn't know how to address them. So we started a nonprofit, My Health Iowa, Mi Salud Iowa, and that helped us to have coordinated efforts to help and empower those individuals. So that's how it all started back in 99 with an idea of what we could do to help our communities, but also to empower them and then help other students to join the movement.
Wow, that's amazing. I love that coming together and bringing the different dishes and that culture to it. And that's just so rich. What role do you think cultural competence plays in providing better health care?
The word cultural competence it's a good concept, but it's also been really argued in our community because we try to call it cultural humility, just because we can't be competent in every single culture. Like it is impossible for me to be competent fully in African American culture, right? I can understand it. It's okay to ask questions. And that's what we do with our students now. We want to make sure that they feel comfortable in asking questions, not making assumptions, because again, that's when these beliefs or perhaps other thoughts about that culture comes if it's because they're not talking about them. So making sure that it's okay to ask questions and have humility, being able to put yourself in someone else's shoes, somebody from Bosnia, from Sudan, somebody that doesn't speak your language, and be empathetic. Nursing is such an empathetic field, but also medicine and public health. So when we all come together with that mindset, cultural humility can really help us to make sure that we can be sensitive to someone else's viewpoint and lived experience, but at the same time competent in the sense that I am ethically bound and ethically doing the right thing for that person, trying to advocate for them, but at the same time showing them the door because they have to walk through it, right? Depending on what it is. If it's a disease process or a screening, making sure that we can give them the resources so they can make informed decisions.
How can professionals in the wellness space build stronger bridges with the communities they serve?
I'm looking at this from an academic perspective. You know, I work as a clinician, as a person that does research. I think there is a gap right now where we're not taking advantage of the nonprofits, the organizations like yours doing a lot of wellness work. We focus so much on primary prevention, but sometimes we stay in our clinics. We stay in our hospitals. We're not doing enough outreach. And so partnering with you, partnering with other nonprofits, community-based organizations, I think it's something that we should be doing now. We should have been doing this a long time ago. And also thinking that we should be collaborating with each other instead of fighting for space or fighting for doing something. There are so many great organizations doing work for the homeless, for minority individuals, and again, it's doing similar work. But it would be so much more impactful if we can just have conversations, apply for dual grants, making sure that we can support each other instead of fighting for resources. Because that's what is also happening at times, what I've seen throughout the years, not only in Des Moines, but in Cedar Rapids, Cedar Falls, in Storm Lake, that there are just so many good opportunities, people doing great work, but unfortunately, there is some type of competition. But I think at the end of the day, just having that discussion with the organizations and also inviting the academic world to not be afraid, you know, to also go out in the community and actually work with the people that are living that lived experience. Not just one time at one event, but actually empowering them with education and resources so they can then continue that work. Because what happened in Iowa City, I moved to Des Moines and the work stopped. There was no one else to continue that work in West Liberty. So now we are regaining some trust in finding individuals that live there, but we learned that giving them those resources, they can actually do the screenings, do the education, focus on wellness, physical activity, nutrition, stress management, mental health. And so, but it needs to be sustained. And that's the part that we were missing back in '99. When we started this, we were all very young, but now it's something that I think we should focus as well. How can we sustain that wellness culture that you're building right now and that you're sustaining in our communities to empower others?
Definitely. So it's what kind of rings to me when you said that it's not about competition, it's about collaboration. You know, and then also, you know, you talk about these nonprofits doing this work. We give Andy Susanna's new podcast a shout out, Give and Grow Des Moines. Check it out. There's some great people doing some great things. You've been involved in leadership and education. How do you see mentorship playing a role in changing the future of public health?
That's a critical point. I think now is the time, actually, it should be all the time, giving back to our students. We were just doing screenings yesterday at North High School, and I had the opportunity to see a lot of great high school students wanting to go into healthcare. And I see that as a missed opportunity. I wish that many of us would have a little more time to actually go to the high schools, talk to the counselors, and many of us, you know, we all come from different backgrounds, so they can actually see that there's a lot of diversity in healthcare nowadays, and that there are many diverse and unique perspectives. And there's a place for everyone For example, if you want to become a nurse, if you like blood, if you like to work with patients directly, that's a great path. If you like systems, public health would be great. If you wanted to diagnose, a physician would be a great role, or a nurse practitioner. So there is a place for everyone in healthcare. And I began as a nursing assistant, and that really solidified the fact that I wanted to work with patients directly. But once I became older, I realized that I needed to give back. And mentorship, again, undergraduate students, graduate students, inviting them to our space to be uncomfortable. Yeah. I love helping my students be uncomfortable in a space where they can thrive and grow. For example, we took students to Costa Rica for 2 weeks, and no one spoke any Spanish. And they were forced, in a way, to be in a culture that doesn't speak English. The food was very different. Yeah. The habits were so different, and they were very uncomfortable, but they grew so much. That happened 15 years ago in that experience. But I'm hoping that nowadays that they have changed and they have grown from that. And I think that's one of the ways that we can empower our students and mentor them, is by showing them a different perspective, so that way they can grow and then find out who they are and what they can become.
Yeah, definitely. That kind of reminds me of that humility you were just talking about, because that's a very humbling experience. I can't go there, I can speak the language, then you come back here, and now you better understand others that are dealing with the same thing, right? You're more compassionate to them, so that's awesome. In your own life, what are some of the health and wellness practices you prioritize?
That's a great question. And I knew that if I was giving advice to others about exercising, which is why I worked with you, and I wanted to go to a space where you told me what to do. I wanted to be trained by someone that I can just show up and you would tell me you need to do so many lunges or run or do all these things, because I was giving that advice to my patients and also to my students. So I felt like I needed to be an example of that. And I love the outdoors. I can't wait to be outside now. We have mud races. I love the 10K mud races. Yeah, and there's one actually in Boone. There's one in Winterset. And I go with my friends. We have a team. But I also like the duathlons. I'm not a good swimmer, but I can run and I can bike. Oh. And as long as I can move and as long as his knees still work, I'm able to just go and actually just do the best that I can. So I try to be as fit as possible. Because, again, if I'm telling others to exercise, to practice wellness, primary prevention, I need to be an example myself.
I love that. It's like, hey, I'm telling you to do this, but I'm doing this. Hey, and then we can see you doing it, because I see you doing some awesome things. You said Tough Mudders?
Tough Mudders, hey, Spartan races.
Yeah,
I've actually gone to Colorado and also Utah a couple of times with friends, and those are grueling. You have to... there are 30 obstacles, and it's about a 10K with 30 obstacles. If you fail an obstacle, you have to do 25 burpees. And you have to actually do them, and the real burpees. Yeah. So you better finish that obstacle, because I don't want to do more burpees.
Yeah, you want to do more burpees. Oh, man. So are you telling your clients, hey, you got to do this Tough Mudder, or where do they start off at?
Well, they start with a small goal, right? Yeah. Whatever is worth for them. And I've learned as a provider that, one goal, it makes so much difference. It's so meaningful, because I can't tell them you need to change 5 things.
Yes.
It's too complicated. And the small change could be just reducing salt. If somebody has high blood pressure, just think about how much less salt I can add to my food, or perhaps replace fatty foods or processed foods with a lean meat, like a chicken, right? Grilled chicken or something like that. So something very small. When it comes to physical activity, 30 minutes a day for 5 days a week, walking, running, whatever they like to do, something enjoyable. Yes. So we work on that, but just one goal at a time.
Definitely. So it's like habit stacking, hey, 1% better every day. Just if you can just take a few steps, maybe walk around the block first, then go to Grace Lake. So I love that. Do you have any fitness or nutrition or mindful habits that help you stay healthy and motivated?
Great question. I think it kind of depends on how much time I have with something. For example, right now I'm cutting, which has been really difficult. I have to lose weight.
Cutting up.
It's difficult. It's very tough. And eating less calories, but also performing at the highest level as possible. So just finding foods that give me energy. That's what I've been focusing on. Just making sure that my options are just, fruits, vegetables, lean meats, a lot of water, and vitamins. And so that's my routine, and being consistent, right? For example, even if you're so tired to go to the gym, and I feel like I can't lift weights, I'm just going to use the treadmill. But just do something, move, right?
Yeah.
I think you also focus a lot on movement, and that's what I learned from you, that even though I'm not able to give 100% that day, as long as I'm moving and as long as I made it to the gym, that's a big step right there.
Yeah, yeah. I always remember when I worked with you too. You would be, you'd be working, you'd be teaching, you'd be doing a lot. You had a whole plate full of stuff, but you didn't make excuses. You said, "Hey, I still got to do this for myself. I got to do this for my health. This is where I want, and this is how I want to look." So that's very inspiring, man. Because some people say, I don't have enough time. It's like, this guy has enough time. You got enough time. So,
Yes.
How does My Health Iowa approach wellness holistically, considering physical, emotional, and social well-being?
Thank you. And, back in 99, again, we were a small group of students at the University of Iowa from anthropology, the Spanish department, medicine, nursing. We wanted to do something and give something back to our communities. And that's how it all started. And then it morphed into something bigger here in Des Moines, where we learned that we can't just be the ones going to communities and doing the screenings or doing the education, but actually giving them the tools to do the screenings themselves with some supervision, and then giving them the resources. Because sometimes, it can be very costly to purchase all that equipment. A medical suitcase typically costs about $1,000, and that includes the blood pressure cuffs, the glucometers, the strips, etc. And I would say that the strips for diabetes is the most costly. Even for patients trying to check their blood sugar daily, those strips are so expensive. And so making sure that we can give those resources to different communities like Storm Lake, Iowa City, Cedar Rapids, Cedar Falls, and then go and continue to give additional education to them. So it's not just happening here in Des Moines, but it's happening in other locations. What we do is that we go to barbershops. I love the barbershop. It's a good time for me to talk to my barber and have a good time, but it's also a safe space for men. Right?
Yes.
African-American men, Latino men, and they don't feel threatened. We have our screenings there, and they can stop by. We talk about the cardiovascular disease, diabetes, obesity. They get checked, and then we refer them. Churches, food pantries, and all the different events, high schools. So we're very flexible, and we adapt to different communities. And actually, as we go to those places, I'm still waiting. Maybe one day a barber will want to do the training so he can also do the screenings.
Yeah, awesome. One of the guys I got coming on is barber. I'll challenge him to do that.
Yeah.
So that's awesome. So you're taking some of these safe spaces or spaces that we're having, and you're creating these conversations that need to be had, and that's really amazing because you might be at the barbershop for an hour or 2 hours. So why not get a little quick education seminar real fast or do a health screening or something? And then who better to talk to? If you could get, man, that'd be awesome if you got a whole barbershop that would do that. Like, hey, you cut hair, but the people sitting in your chair, you have a really chance to make an impact with them. So maybe they'll listen to this podcast and they'll get it going. What role does mental and emotional health play in the health initiative you provide?
That is everything. If you are not mentally well, if you don't have the energy, if you have a lot of stress, you're not able to function daily. I think of it as with my patients with Alzheimer's disease or dementia. Many times they want to do things, but because they're tired, because of their disease process, they're unable to do the things that they want to do. And so somebody who's depressed, somebody who's anxious, they have less energy to do the things that they want to do, to go to school, to go to work. They can't perform well. You have this cloud in your mind, and it's happened to me as well. I've been depressed many times in my life. I have a family history of chronic depression. So I knew that exercise, meditation, sleeping more, which I'm trying to do, get 6 to 8 hours a night if I can, it's so critical to help me have my mind clear and stay in the moment. One of the things that I tell my patients is that, are you always on your phone, even at night, watching your TikToks? Because many times they complain, I can't sleep well at night. And then I ask them about some of their habits, and one of them, they would say, well, I'm still scrolling on my phone at night, and that's keeping you awake. And that's the reason why. So I tell them, instead, read a book or do something else, take a hot shower. And I jokingly say, and I think I'm funny, but I know I'm not, that if you read a book, that will put you to sleep. Because I tell them, I read a book, and I'm just out. So that will definitely help. But I think once we can make sure that person has stability emotionally, doesn't have much stress, and is able to cognitively be more present, then they can actually do the things that they want to do, and they can manage any diseases if they can prevent them and do things that they enjoy, right? More time with family, friends, more time for yourself, because we many times neglect taking care of ourselves. We take care of others first, especially in Latino communities, before we take care of ourselves. And I've seen that in my own family too.
Definitely. How are environmental and social wellness integrated into the programs you're creating?
So I know that I'm not an expert in social work, right? My training wasn't on the social services, the economical services, immigration. You know, there are many things that I'm not an expert on, but I know someone. Like, for example, if I have a question about physical activity and nutrition, I know that I can go to you, Jeremiah, for those questions. But I know that I have friends who are lawyers that can talk about immigration. I have friends who are social workers who know the services for the homeless or for others. So making sure that we can refer them and also have brochures and information at our table. So when we do the screenings, it's like a one-stop shop. We want to make sure that if anyone has a question, that we can definitely connect them to those resources in the language that is adequate for them, and to make sure that they can find solutions, right? We want to make it a little easier because there's so much available now. A lot of misinformation, like from about vaccines, for example.
Lots of noise.
Exactly. Like the measles outbreak, there's just so much noise about that you should not get vaccinated, but that goes against our practice, what the evidence tells us. So again, just making sure that we can connect people with those resources. And so again, knowing that I'm not an expert in every area, I know that I need to rely on the expertise of others and making sure that I can make those connections and also bring them at the table. I tell my students jokingly again, and I know it's not funny, that if you are not at the table, you are on the menu. And if you're on the menu, they will talk to you and they will make decisions about your health and about you, and you're not at the table. And I tell them, if there are no chairs at the table, bring a chair, add another one. You know, be part of that conversation, because if we are not present, other people, like other legislators, policymakers, will make decisions for them. So we want to make sure that we can, again, be at the table, be present.
Yeah. No, I love that, man. That's powerful. We're going to clip that. Financial wellness is often a barrier to health. How do you address the financial concerns many of these underserved populations face?
We have learned that many organizations like Primary Healthcare in Des Moines, the federally qualified health centers, we have 15 of them in the state, Broadlands Hospital, and other institutions, Mercy One, Unity Point, the University of Iowa, they have programs that can serve underserved communities, low income, undocumented. So making sure that once we have the screenings and we have talks about this, that we can connect them to those resources, but also talking about that perhaps there might be a fee, a sliding fee of $5, $10, depending on the scale. So being upfront about that, but also understanding that if somebody goes to the ER, perhaps if they don't have insurance, that might be a little costly. So perhaps making a decision to go to an urgent care, or or talk to us first, so we can help them to make a decision. Because again, unfortunately, our system it's somewhat broken in terms of how to access healthcare. We don't have a universal healthcare system. So if you don't have insurance, that can be a challenge for many people. So the ones that we screen and we provide education are those that most of them don't have insurance and are also undocumented. And so making sure that we can still give them the education and the resources that they need to be healthy while they're here. And so that continues to be a dialogue. But again, we rely on the expertise of the community health centers. And they have social workers too. They have great people that can provide that assistance and education as well about how healthcare system works in the United States, because as you know, it's very complicated.
Yeah. What's next for My Health Iowa? Are there any upcoming initiatives or projects that you are especially excited about?
Yes, actually today we're going to Storm Lake later.
All right.
So 2.5 hours north driving. I've been there several times, and we have another organization called Salud, and they were very excited to get the medical suitcase and go through the training. Also, we have another initiative happening in Iowa City with another group of individuals that want the same education. And also in Cedar Falls, we just met with another group that wants the information in French. There's a large African community that speaks French in Cedar Falls and Waterloo, and they want to go through the training so they can do the screenings as well.
Wow.
So now the project has, again, evolved into empowering different communities that have nonprofits that are stable, that have the bandwidth and the people that want to do the work, and we give them the resources, right? We want to make sure that that the cost of the equipment is not a burden for them. That the education, it's free. All of it, making sure that they are able to do it, right? And so that will sustain, that will help our communities thrive. And so this is just, I'm hoping that in 10 years, perhaps there might be legislation or something that can help us to fund some of these models that we're testing, right? We are grassroots. We are, again, working with underserved communities. But again, there's an opportunity in the larger picture that perhaps our local government can support us and that they can see that this model of public health works. In addition to what already works, we have Polk County Public Health. They are doing great work, but the work that we're doing is really hands-on in the community, in places that are safe for people. And we just don't go there, but we also empower them to do those services and to provide that education.
Awesome. For individuals who want to make a difference in their own community health, what advice would you give them?
I think talk to someone that is doing some of the work. There are many physicians, nurse practitioners, social workers, public health people that are wanting students, people that will go to them, and they will most likely very happy to shadow and answer questions about what they're doing, and perhaps include them in projects, right? For example, I had my DMU students, my medical students, be part of some research projects. So there are several things that we can involve students. Somebody wants to be more involved in research, we can do that. Somebody wants to do more practice things, we have a clinic, we can do that. If they want to shadow me how I teach, they're more than welcome to do that. So all of us are making contributions, and I think that's what's important, right? We all make contributions every day in a different capacity, and there's no competition, right? It shouldn't be like, oh, Dr. Reyes is doing all this and that, but I want other people to do that work. So I'm trying to bring them in, pull them into this space. So I want to see them success. I want them to be successful. And so I'm at the point in my life that I want to continue to give back because I've been blessed with so many opportunities here, 25 years in Iowa now. I think I have a good understanding of how things work, but I also know that there are people that just are arriving here or actually in high school, trying to go into the workplace, and they need to be exposed to that. So we welcome everyone,
yes.
Anyone that has a passion to help others.
Awesome. Now we got what I call the no excuse mindset round.
Please.
Okay. What's one personal excuse you had to overcome in your journey, and how did it shape who you are today?
So I grew up in a household that had a very strong woman presence, right? My grandmother from Chile, from my mother's side, she was a public health nurse, very strong individual, took me to different places. But my paternal grandmother, Aniseta, she was from Peru, and she grew up in a very small town called Huacar by the Andes Mountains. She was a farm worker, and she moved to Lima, the capital, when she was 10 years old. And she started to work. This is back a long time ago where child labor was accepted in some societies. So she was working, and then she helped her siblings to come to the capital. And then she moved to the United States eventually in the 60s, and that's how we migrated here eventually. So I think just seeing the adversity that she had to overcome, both of them, right? My grandmother from Chile had to overcome adversity in health. My other grandmother had adversities in farm work and actually coming to the United States. And just seeing that sparked something in me, and sparked a lot of things in many family members that, you have the power. You are the only person that can stop yourself of doing something. You have the power to do so much. And if you have a space, if you are given an opportunity, make sure that you take advantage of that and run with it. And don't look back, but look back for others to help, right? Making sure that you're always bringing someone in. Because my grandmothers, they helped everyone. They wanted to make sure that everyone was successful, and they made lots of sacrifices. Moving to Iowa was a huge sacrifice for me. I had to step away from my parents. I was in a place that was very new. I didn't know anyone here. And again, if you start from the bottom with nothing, and I was a very poor college student. I remember eating rice and tuna every day. That's all I had for food. You can make it. There are definitely not no excuses. And but you can also relate with other people, right? And so listening and having these stories and these conversations, I'm hoping that it can help others, that if you're in a tough place right now, financially, emotionally, know that you are able to overcome that. You are the only person that will push yourself back. Just take a deep breath, look at your resources, rely on people that can help you, that can give you advice, and surround yourself with people who know more than you and who are very positive. Because nowadays, with this societal climate of so much information being thrown at us, it is fine to be quiet, to listen, and to reflect. Yeah. And that will definitely help you in those days that you are not doing well. Especially the first couple of years, it's going to be tough. But eventually, you'll get there to a place that you're financially stable, mentally well, that your family is fine. It takes a lot of hard work and sacrifice.
Yes. I love that mindset, and what a powerful and amazing journey you've had. When you hear the word perseverance, what story or moment comes to mind?
I would say my farm worker patients right now in Iowa. We are expecting about 5,000 migrant workers this summer. And many of them have been here before. They're only here for a couple of months to work during the summer. And they do very hard work, right? They're the ones actually putting food in our plates every day. And sometimes we just don't take advantage of that. We don't think about who's bringing the fruit and vegetables in our tables. And many of them are actually people, our neighbors here in Iowa. And so making sure that, they have also many challenges, right? They are working really hard, 12-hour day shifts, 7 days a week. But also they live in very difficult and challenging conditions. I mean, the farm owners are really trying hard to give them housing and education and food, healthcare. But again, the resources are very limited. But their perseverance of still coming to another country with a different culture, different language, knowing that they may have to sleep in a stable, right? A big stable where there's a lot of other workers, which may be uncomfortable. It can be hot in the summer, as you know. Summers in Iowa are very humid and hot, and being exposed to toxins and outside, even despite all of that, they're still able to come and work because they want to help the people that they support and that they love back home. So their perseverance really is admiring, and I'm just sharing a small story of what they experience. But I'm hoping that, and it's much better than what it used to be. But that's something, again, that we need to continue to advocate for, because they're the ones that don't have a voice.
Yes.
They're not at the table. They're on the menu, and we talk about them. We make decisions for them. And so we need to find people like you and I and others that can speak for them.
Be a champion for them, definitely. I love that. What's something you failed at, but now look back on as a necessary part of your growth?
Can you say that again?
What's something you failed at, but now look back on as a necessary part of your growth?
I would say reflection. In my younger years, I was very, very busy doing many, many things. The nonprofit, working 2 full-time jobs, taking care of my parents, helping my siblings, helping my patients, helping my students. I never took the time to reflect, and now it's been 25 years that have just flown by so fast. So what I've decided to do this year is to actually write. And the power of the pen has never been so powerful. I've already published 4 different papers, commentaries, articles on different topics, ranging from immigration, how to take care of persons who are undocumented, how to empower other Latino, African-American students, Asian students to be in leadership positions. I'm taking the time to reflect and write, because there's so much that has happened, so many lived experiences that I have not seen in the literature. I don't read about them. So I want to inspire others that they have also the power of the pen to reflect and to write that down, because that's your legacy.
Yes.
Working on what are you leaving behind to others so they can have something that they can reflect to or look forward to or to reference, right? And also, if I'm telling my students, we should be using the evidence, I myself need to be also being part of that discussion. I need to be involved in the evidence and write and publish.
Yes.
So that's so important. So I would say that the reflection And having the time to write, it's been one of the things that really has helped me now that in the past I took for granted. I was so busy doing so many things that many things got lost, but now taking the time to reflect and write and then share that with others.
Yeah, reflect, write, and redeem them. Because we go through this journey and we're so focused on the journey that we don't ever sit back and really smell the roses or say, hey, this story could probably help. And then, 50 years, 100 years from now, somebody just might read that and say, they're impacted by it. So you left a mark greater than yourself. So like you said, legacy. If you could go back to your younger version of yourself and give one piece of advice, what would it be?
Spend more time with the ones that you love. My grandmothers were very, very strong, very independent people, but I did not spend enough time with them in terms of, outside of the workspace. I wish that I would spend a little more time with others and not think about work so much. I love what I do. It's my passion. But at times I feel like I'm not giving enough time to my family. And, you can't do everything, right? It's just, it's almost impossible. But having that balance, the work-life balance, would be something that in my younger years I did more. I wish I would have learned that habit a little better than what I do now. And that's much better than what it used to be. But that's something that I missed, that, many of them have passed away, or I don't see them as much anymore because I'm in Iowa and I don't see them or visit them as often. So those missed opportunities, like I missed birthdays or events, weddings, etc., because I prioritize my work or other things. So again, my advice would be to find a balance of making sure that you don't have regrets by not spending time with your loved ones.
Definitely find balance, yeah. Because as they said, the only people that's going to remember that you worked them late hours is them, because you weren't there. So yeah, so true. What do you think holds most people back from stepping into their calling or purpose?
It is difficult taking that step. We always talk about, and we're having a discussion right now, which is important, right? The lived experience. But taking that first initial step is very scary, especially when you are in an uncharted terrain. I had many mentors at Iowa that told me, you need to form your own path. You can't be following someone else's path. You can learn from what the mistakes and the things that others have done, but you have to carve your own path. And they always told me, you can't just be talking the talk, you have to walk the walk, as we say. And so making sure that first step, even though you're going to make many mistakes, you have to just act. We can't just have or live in a place that we're just talking, because there's so much noise. We talk about it so much. For example, in nursing, there's some things that we should have been changed a long time ago, and they haven't yet when it comes to education or our scope of practice or things that we could do, that we keep talking about it, but there's no action. And so again, going back to that example of the power of the pen, that is one way that I'm taking a step, action. I'm in a terrain that is very uncharted for me. I don't publish as much anymore, but just writing and sharing that story, it's been something that, again, I welcomed and being uncomfortable. Because I also tell my students, you need to be uncomfortable to learn and grow.
Yes.
So I need to do that myself as well. And so I think that has really helped me to make sure that I can move forward.
Definitely. Yeah. Get uncomfortable. That's where the change and growth happens, right? No struggle, no progress. Finish this sentence. There's no excuse for...
exercise. I'm thinking about you.
We'll go again. There's no excuse for...
Is this a trick question?
No. No. This is what pops in the mind. Like, you think you exercise, though? There's no excuse for not exercising?
No, that's kind of a silly answer. I'm just trying to think. See, I'm in a very academic space right now when I'm talking to you, that I'm trying to be funny and find something that it's more enjoyable.
Yeah.
I would say that there's no excuse not to be outside. Right now, I work remotely every day, and I love it, but I'm in my office so much. I need to force myself to be outside. If I'm not outside, I'm not well, mentally or physically. So I would say, just take the time, like you said earlier, smell the roses, smell the flowers, just take a walk, be outside and refresh your mind. There's no excuse not to be outside. If you have two legs, and even people who are unable to walk, just being outside, being in nature, being in contact with the environment. Because again, we are so much focused on our phones every day. We have it with us, with the computer. We're always synchronized. And I'm also watching the series again, Black Mirror. Okay. Which again, it's a sci-fi show, but I just think about those experiences that again, we're so focused on technology, which is great. It helps us, but we need to be disconnected, right? There's no excuse not to be disconnected. If you're taking a vacation in Mexico, I don't want to see pictures right away. I want you to be in the beach, enjoying, having a drink, spend time with your family, talk. When I see concerts, right, and I do this myself, I should not be recording. I should actually be dancing to Missy Elliott or to other people, that I really enjoyed, instead of just actually video, live in the space, being present in the moment. In the moment. That's like The Power of Now by Eli Tolick. It's like, hey, live in the moment, I think we're so geared up, I got to record. I got to put up, the camera so everybody can see. But like you say, hey, experience it. You can share it later. You can always share it later. So, and then I feel like the phone has probably led to a lot of mental wellness issues, right? Because your mind is so busy. You talked about people being on their phone at night and not being able to sleep, and then now you got lack of sleep, which is not good for your health. Now you're not able to function on your job like you're supposed to, which is not good for your job. Now you're not able to show up like you're supposed to for your loved ones and significant other. So it becomes a ripple effect. So cutting off that phone and just getting out there into the environment. I love that. Man, Dr. Reyes, I appreciate you, man. Thank you, Jeremiah. It's been a great conversation. Yes, sir.